you could see right here a video called Lab Models Recap Unit 2, and then also a link, Lab Exam number 2, list of what will be tested. And then this list is just a complete list for you of the bones that will be on the exam and the models that will be on the exam. Somebody had asked me, I'm not sure if that person's here today, but somebody had asked me in a message whether you need to know functions for the lab exam. And I would say the overall answer to that question is no, you don't really need to know functions. The majority of the lab exam is going to be just focused on identification. Okay, so we're just going to be identifying stuff. Just to show, oh, hopefully this doesn't, okay, we're good. Just to show you this recording here, there is a recording that Knudsen had made. This was back kind of during like COVID, but he had made this of all of the different models. So this is kind of grainy, but it is helpful because it does go through everything. So if you're interested in that, that is available to you. In the same module, you don't have to watch it, but it is available. All right, so kind of reminding you guys just the overview of what's going to happen on the lab exam. And then today I'm planning on going through stuff. And then as we go along, if you guys have questions, I'm back on my computer this week. I don't know if you remember last week with or Monday with my iPad thing. Anyway, so I'm back on my computer, so it's really easy for me to see the chat box. So if you have anything, just use the chat box and I can see that. So for the lab exam, remember that the main portion of your lab exam is going to be on bones, right? So you're going to be tested on bones. So when we look at that, you're going to be using your Blue Allen lab book, right? Just to clarify, I know most of the people that are in SI probably aren't confused about this, but just in case anything was lost in translation, you are supposed to memorize the numbers on the bone and then the names here on the columns. You do not need to know anything on the bottom of the page. Again, numbers, names, nothing on the bottom of the page. You also need to know whether a bone is left or right. Okay, again, names, numbers, nothing on the bottom of the page will be tested. And then you do need to know, for example, like a rib, whether a rib is a left rib or a right rib. And your test will look very similar to this practice exam. I posted this practice exam in the announcements of your class. So if you guys want to take a look at that, it should be available to you. Again, it's in the practice, the announcements for your class. It's titled Practice Unit 2 Bones Lab Exam. And then I said available for your review. It was posted on March 7th. If you click on that, it takes you to this link that I'm on right now. Okay, and this link has basically what the exam will look like. These are not the same exact like colors we use, but I'm just saying it will look like this. For example, we'll have it colored in, and then the questions will read something like this, but each will have a multiple choice with none of these. And it'll say identify the structure in green, and then it will give you 5 options, including none of these choices. Do you see how it already says the bone at the top? So we're not going to be asking you on the test, is this an ulna or a radius? The questions will be, is this a left or a right? Which you can see should be right here, right or left. And then they'll give you 5 options, A, B, C, D, and then E as none of these choices. So utilize the practice exam in the announcements this weekend. The answers are right here, posted inside of the link. You've probably already seen this in lab. If you haven't done it, that's great. But if you have not done it and you want an opportunity to practice or repractice, it should all be available to you here. Good. Any questions at all on that? So that's the majority of your exam will be focused on the bones. Every single bone will be on the exam at least one time. Some of them are on there multiple times. You should have 130, possibly 135 questions. 100 questions is on the bones. 30 to 35 questions are on the models. And in the past, those have always been fill in the blank. So again, the bones, 100 questions, multiple choice, with none of these as one of the choices, which does make it very tricky. And then the models, 35, somewhere between 30 and 40 questions, fill in the blank for the models. Good? Everybody got that already? We all know that? All right.
I have a question.
Yeah.
So you're saying that the numbers on the bones are going to be on the exam?
No. The numbers on the bones are on these pictures. I'm just saying that that's what you're responsible for knowing, is like these parts and then what they mean on this list. So a lot of students ask me, do we need to know these definitions down here? And I just am trying to make sure you guys know, no, you don't need to know these definitions. You would just need to know like what this, so like if we give the example that I was just looking at, number 5 is the semilunar notch. And then on the test, we will color it in with a blue marker.
Okay.
And then we'll say, what is the blue? And you say semilunar notch. Does that make sense? Because they're in the same like spot.
Okay.
And then there. Does that make more sense?
Yes, thank you.
Yeah. And then you guys are turning in your cardiovascular lab packet, right? So your cardiovascular lab packet, you would have already completed at this point, I'm pretty sure, right? So don't forget, you're going to be turning that one in. Make sure the ones place I would say students don't forget, like don't forget, they do forget to fill in and then they miss some points, is right here on page 16. You do need to fill this in. And like I've shown you in SI already, you can just Google 2006 Pearson Education heart diagram, and it will pop up with the exact same one if you haven't done that already. So you do need to label this for full points. You'll get 2 or 3 points taken off if you don't label this page. And don't forget to fill these in. Depending on who's grading, you'll get 2 or 3 points taken off per page if you don't fill them in. And you can use these to fill them in. I know you already had your blood tracing quiz, but at the same time, maybe you forgot to fill them in on there. So just make sure everything's filled out on that packet. Okay. So that's your cardiovascular packet, is the only thing you're turning in the day of your lab exam online, right? You're testing primarily on the bones for 100 questions. And then you're going to do 35 to 40 questions, fill in the blank using the models. Okay, so the first model that will be on the test, they won't necessarily be in this order, but these are the models that will be on the test. You'll have your heart model, right? I'm going to go in order of the numbers. Your blood cells models, your white blood cells, the large and the small, and then the blood clot. Your standing kidney. This is already pre-labeled for you. And remember that there are videos of the SI going through each of these, so that's everything you need to know. There are also keys for what you need to know. So for example, the heart, we have this key, that's the list of what you need to know. This one has the key. Thorax, same thing, you're gonna be going through it. This will be on the test. Here's the list of what you need to know and a video explanation. Same thing with your digestive model. Your intestine model has a video, a list, and a picture. And then your salivary gland. Again, 40 questions on those, fill in the blank. 100 questions on the bones, multiple choice. Okay, so that's your overview of what the lab exam will look like, all right? let me see if I can find the few. I don't know, I might miss one, but let me see if I can remember the few things that are on the bones that you would have had mentioned to you in person, but they are not found on your lists in the packet. I believe there's two that I can think of. I think there's three. All right, let's find them. So there is one on this sternum that you will be tested on that is not directly found in your packet. So we're going to look at this, and then I'm going to go to this page and I'll show you guys which one it is. You should have had this again explained to you in person, but just in case. So it's this, should be this line right here. Let's see, 6B. Yeah. So does everybody see this line right here? This little line. And then if we go over here, it's this pink line. Is everyone following me? So this is the same type of thing we'd use on the exam. And you need to know on the exam what that pink line is. The pink line is the sternal angle. Again, you're not supposed to know these things that are over here. I just know that sometimes we can find bonus stuff over here, and there's a few terms you need to know that are not on this list that you'll need to know for the test. So on the test, the name of this pink notch is the sternal angle. Okay, the name of the pink notch would be the sternal angle. I believe that we do, yeah, that should be. Okay, so pink, so that you would want to write that down somewhere. The pink line, this is where the manubrium and the body of the sternum meet. It's not necessarily going to be pink on your exam. It might be purple or blue, but it'll look just like this and be colored in. And this is called the sternal angle. Does everyone have that? Yes? Good. Sternal angle. Okay. I'm going to leave it up here. That way, when I show you the next one, we can go back to it. The other one you need to know is going to be on your fibula. Let's go to our fibula on here. All right, so right here on the fibula, it's going to be called your looking for my name here. It looks like an olive pit. Should be called this green dot right here. So it's going to be number, I don't want to say it wrong. It should be the malleolar fossa, 113. I'm almost positive it's malleolar fossa, but I don't want to. 113. 113 is your malleolar fossa. Okay, so it's going to be, I'm going to pull it up again. So the malleolar fossa is going to be on the fibula. It's the shape of an olive pit. It's on the inferior, what would it be, medial side of the fibula, where it articulates with the tibia. Okay, so if we go to the tibia and the fibula again, let me show you on this picture. So on this picture, it's going to be down here. Is that making sense to everybody? Hopefully this sounds really familiar because you already heard it talked about in class, but the malleolar fossa is down here. So inferior and medial, because it's closer to the central line. So if we go here again to this picture, this would be inferior or down towards the feet, and medial, medial just meaning that it articulates with the tibia. So again, it's this green little part right here. That's called the malleolar fossa. Can everybody see it? I know that it's a little blurry, but do we all get the idea of where that is? So that's one of the ones that will be on the test that's not on your list, malleolar fossa, right here. That has definitely been mentioned in lab. I'm just making sure everybody has that, okay? Good?
I have a question really quick.
Yeah.
So for like the tibia and fibula, for example, where there's like the interosseous borders and then the lateral surface of the tibia, like how, I'm just afraid that that's going to be like a question on there. And like, how do you tell the difference if it's just like colored on the side of the bone? You know what I mean?
So you would need to first kind of determine if it's left or right, and then you should be able to determine which one is, I believe. So I think that the way that worked the best for me, if I'm remembering right, and I'll try to, I'm going to look at the answer before I say this, because I did these a long time ago, so I kind of like remember things, but then sometimes I don't remember it right. So I want to make sure I don't misspeak. Yeah, so I was right in what I was thinking. Okay, so let's go back to it and I'll show you how you can tell. So right here, since we're already on this one, this would be, right, the two you're talking about, right?
Mm-hmm.
So do you see how much more like rigid this one is? It looks like a mountain peak versus this one's kind of soft. Your interosseous borders are more pronounced and taller because they actually hold a membrane. So remember your interosseous joint, the one that you guys learned about, intermembranous, or that one, the interosseous, or what's its other name, synchondrosis. That right there, the rigid portion, is because it's holding that joint. So if you look at it, it's much more raised when it's an interosseous border versus the lateral border is going to be very soft.
But so for like the lateral border or the medial surface versus the lateral surface, isn't that like the whole length of like the diaphysis of the bone, or is it like a specific part on the bone? Like I think that's where I get confused, because the numbers are like just in one spot, but wouldn't it technically be like the whole length?
Where are we at right here?
Like number 17 and 13 on the ventral side.
Lateral surface of tibia and medial surface of tibia. Is that what you're talking about? Or is that on the fibula as well?
I'm mainly talking about the tibia and like the interosseous borders.
Let me see what this line
like I might just be overthinking this because that's what I do, but
no, I'm the same way. That's the only, oh, that's the soleal or popliteal, must be the soleal or popliteal line. This number, wait. What is this right here? Let me just go to the answer. That's less confusing. The orange, number 115 or something. Interosseous border, anterior crest of the fibula is this one.
Yeah, I don't really get confused on the anterior crest. I think that there was a question.
Let me go to the tibia. So we know that this is that, this one's really easy to remember. Of course, I can't remember it right now, but should be 14, right? Yeah, anterior crest of tibia. So that should be, you got anterior crest of tibia because that's like the only thing it could be. Yeah. Medial and lateral surface. Sorry, sometimes when I visually see it, it's like I remember it. You would just find your medial, which would be obviously this part, right? Because this is your medial surface where it's like that down portion, and it would be the whole smooth side on one side of that anterior crest versus the other side, the lateral surface would be kind of that whole smooth side. So if I were to color that in on the test, I would be coloring it like down here like that. Maybe not the whole bone, but at least like enough that you could tell that it's not the crest.
Okay.
Does that make sense?
Yeah, I wasn't sure if it was like gonna be on, like if the lateral or medial surface would be on the exam. I just don't want to get it confused because I know that in one of the practice questions, one of the answers was interosseous border, and I'm like, couldn't that technically also be the lateral surface or whatever. I can't remember what it was, but I just got confused on that one.
So it shouldn't be, right? Because the my interosseous border needs to be on my lateral side, like what you're saying. So you're basically saying what's the difference between the lateral surface and then my interosseous border. And the reason you would be able to tell, I don't think I have, let's see if I have a picture that even shows that. You should be able to tell the difference because the lateral surface would be the smooth, flat part versus my interosseous border, like I was saying with the fibula, would be raised and like a ridge.
Okay, that makes sense.
So they would be colored. They would be colored in different spots. I mean, the ridge is on the lateral surface, but if we're asking for the lateral surface, that's going to be on the smooth part versus the ridge.
I feel like some of the bones that I have at home don't have like as much like pronounced ridges and stuff as the ones at school. So I think it's been hard for me to see that at home, but.
Yeah, at home, it's like you can study 95%. And then at school, it's like there's like some other little stuff. I would recommend, since now it's should be the weekend, right? And you have your test. You have your test on Tuesday if you're taking Knutson, right? People in here should have it on Tuesday. The tutoring center, the same like place where you are right now, where we're having Zoom, has a physical one. I don't know if you've ever seen it. They should be open on Monday and they have the same bones we have in lab. If anybody's interested in going on Monday and getting like a few hours to like see if there's anything you couldn't really see in person, the few that I would really recommend to you if you like wanted to go look and you could make even just 1 hour work on Monday to drive to campus, I would look at the clavicle. This one is very different than the one you have in your bone packets. It's just higher quality. I would look at this one, and then I would look at the base of the skull. If you guys only had like 1 hour and you could only just look at like 2 bones on Monday, if you can make a while work, I would look at as many as you can. But the skull and the holes in the skull, I would absolutely do everything I could to go on Monday and go in person and go ask to see a skull and take a look at it for like an hour. Because these, all of the holes are on the exam. Like every single hole is on the exam. And they look very different than whatever you guys have at home. So this one is one I would highly, highly, highly encourage you to look at on Monday if you can. That'll really help you for the exam. Everything else should be very doable at home. Okay, so I don't want you to feel like, oh no, like I can't study these this weekend. I don't have the same ones. I would definitely say that's not true. Like if you look at the sternum, when a bone is bigger, it's not like it matters if it's detailed. Does that make sense? We're just asking you for the posterior like surface of this sternum. You don't really need a detailed, perfect model to find it. You can also use these pictures and see pretty clearly like what our bone looks like and what your bone, and then kind of use both this weekend. But I would say that the only one that even is a problem is just the holes of the skull and the clavicle. Other than that, you really can make your bones work at home and you shouldn't have any issues for the exam. The last, by the way, I'm very happy to spend some more time on the bones if people have questions as they come up. But the last one that is on the test and isn't on your pages is the sagittal suture. So it's this blue line right here. So blue line equals the sagittal suture. It's just the one that goes right down the middle. Remember your planes that you learned about on the first exam, your sagittal plane, mid-sagittal plane, all of that. So that would be your sagittal suture right here. It is going to be on the test. It's not on your list. So these are the 3 things that should have been mentioned in lab to you. They will definitely be on your exam, but they weren't on your list. Again, I'm not the only person telling you this information. You've heard it in lab, but I just want to make sure you guys have it written down. Okay. Sure. Yeah, we can go over the vertebrae. Okay, so let's take a look at our vertebrae. So I would definitely tell you guys and encourage you to look at this exam, this lab exam, practice exam, very closely. It's a very good reflection of what you'll be tested on. Again, I know I've said this before, but I'm just making sure I emphasize it. We don't take these same bones and use them on the exam. We have different bones, but they don't look different, right? They're going to be the same structure and everything. And we color them the same way. We just color them with different colors. Does that make sense? Hopefully everybody's like following me. So there's not like going to be trick stuff. If you use these practice bones, I would say it's going to be really, really helpful for you. So looking at the vertebrae, we want you to look at your surfaces, right? Your articular surfaces for the other vertebrae. So I believe this should be your articular surface for the body and your articular surface for the lamellae. Again, like I told you guys, I took this class 3 years ago and I go over the lectures all the time, but when it comes to the bones, that's not something that I continuously rehearse. But let me go to the answers just to make sure I'm not saying something wrong. So we would be on 65 through 70. So when you're looking at your pages, I'll go and show you. So when we're looking at the answers, we have like the facets, right? You want to know your facet for tubercle, or inferior articular facet, spinous process, pedicle, superior articular process, superior demifacet for head of rib. So that's like 5. And then we go to your vertebra page in your packet. Okay. So there's a lot of vertebrae, right? So there's these 3. The only thing you're supposed to know on these 3 is how to tell the difference between it being the, this is called the axis, atlas, and this is the axis. So you do want to tell the difference between the axis and the atlas. And you need to know the difference between cervical, thoracic, and lumbar. But you don't need to know all the different parts on them. Okay, so for the vertebra, you need to tell, is it axis or atlas? So for this picture, figure 115 would be your atlas. And then figure 116 would be your axis. 116. So you would, if we gave you a vertebra, can you tell if it's an axis or atlas? And those are just 2 vertebrae very specific to the top of your neck. They help turn your skull. So the atlas sits with your sits on the top of your vertebra, your cervical vertebra, and your axis holds the skull. So they kind of turn. And then we have your tell the difference between your cervical, your thoracic, and your lumbar, right? Remember that you have 8, 12, I believe it's 7, 12, and 5, right? Breakfast at 7, lunch at 12, dinner at 5, if you guys remember that. So that's one of the things that you'd know. And then for memorizing the parts of the vertebra, we're really wanting you to look at this typical vertebra, which is on page 16. Okay. And then as you could see, we on this one right here, sorry, I'm trying to show you guys. Okay. 65 through 70 is very focused on the thoracic vertebra. And I would tell you that the thoracic vertebra is probably your best one to look at because we have everything that's on the typical, but a little more. So take a close look at the thoracic vertebra for the parts. Again, the other ones are going to have less things than the thoracic. So for which vertebra you should study, you would study all the parts of the thoracic, and then you would need to know the other things that I put on the left. Is that maybe more clear the typical vertebra parts are all part of the thoracic vertebra. So we have you look at the thoracic vertebra because it has more parts to it that you would want to look at. Okay, so you want to know all of those: spinous process, lamina, all the different places that things can articulate, the notches, processes, demifasciate, all of that stuff. And as you can see in our example in the practice exam, that's what's colored in on this thoracic vertebra, right? You guys can see all those different articular processes that are all colored in. So I would just recommend using the lab exam, practice exam, to help guide you this weekend, because it's not that I'm saying it's exactly like the test, but it kind of narrows your focus and gives you a better idea of how we're going to color things in. For example, I remember, it's funny how you like look at pictures and it like kind of comes back. I remember this was very confusing to me in the picture, but then when you see it colored in, it makes more sense. So do you guys see the little green guy right here on the back of this? So if I look at my picture, that was trying to show me this little back portion, okay? And it just helps because then you can see how it's going to be, how it's going to be actually colored in for the exam. So that was our green, which should be our number 60, number 69, superior articular process. And if we go to number 69, right here. So superior articular process on your exam will be colored in like this. Does that make sense? And then if you look at your packet, it's like really hard to see it. Is that kind of clear? Does everybody see what I'm saying? So when you use the practice exam, it will help you determine kind of how we're going to color it in so that you can study it better. Good? Because you can see kind of exactly where it's going to be located. I don't know, for me, again, that was what was helpful. Or like right here, you can see this brown portion is like back behind here on the underside. So that's going to be these guys right here. And again, it's like another example of something that was really poorly colored in. And I think the best place that you can see that, I'm trying to remember where you can see that the best. I think it's like one of these that's rotated to the side. I think it would be number 3 here, would be this guy. So yeah, I'm just, again, trying to overemphasize, use the practice lab exam to your advantage on some of the bones that are a little more confusing. It's going to be showing you kind of what we're looking for, but simpler. So the brown is the inferior articular facet. And the best place to find that is, yeah, right here on this guy, 3, inferior articular facet or inferior articular process. Okay, so the just so you know, if anybody in here is confused about the vertebrae, we need to really reorient the way the vertebrae are tested. It's kind of confusing, so you're not the only person confused. I was very confused when I was in the class. So again, I recommend studying the thoracic and using the example from the practice lab exam to kind of show you how that would look on the test. Not all of them are that confusing, but the vertebrae is definitely one that's more confusing than others. Kind of go through it. The innominate bone, definitely look at that. I remember when I was taking the class, that one was quite confusing for me just because there's so many parts on it. Take a look at, go through here. This is all kind of stuff that's pretty obvious that you would go over quite a bit. Your clavicle, like I said, look at your clavicle in person. Ideally, your one that you guys have to practice with is really different. But if you don't have time on Monday to drive to campus, again, well, regardless, I highly recommend you utilize the practice exam. It has pretty good pictures that should be able to help you get an idea of how it looks different than the ones you guys have at home. Your rib, take a look at your rib. This is one that confuses students quite a bit. Remember, your groove goes down and then this would go lateral. So to determine right from left. So this rib should be a right. Okay, let's go check and see if I'm right. 51. Yes, it's a right. Okay. All right. Make sure you go over your clavicle. I would say this is another one I see, not clavicle, mandible is another one that students kind of forget to look over. So make sure you look over that. Again, the skull, please look over the skull. The skull occupies, I would say, 20 to 30 questions of the exam on just the skull alone. There's a lot to know on it. Don't neglect going over it. I really recommend you utilize the pictures here. Okay. Is that pretty clear? Does everybody kind of feel a little bit more direction of what to do this weekend in regards to the bones? Silence is understandable.
Question.
Yeah.
For the hand, I think that was the hand that you just scrolled by. Do we just have to know the some levers try positions they can't handle, or do we need to know the metatarsals, I think it is for the hand? Because I see it's
That's the foot. It looks like we don't have a hand on this practice exam, but the hand is on the actual exam. Let me pull it up on here, because sometimes when I like see the list, then I remember better. So yeah, you definitely need, like you said, some levers try positions they can't handle. That would be the main thing we're going to test you on, but you do need to know first, second, third, fourth, fifth metacarpal, because that's really easy. That's just, you know, first would be your thumb and then it goes out, but you're probably going to be tested on it on one of those, you know, so third metacarpal, but that's 1 point and that's easy to look at, right?
yeah.
Radius and ulna, no, that's just showing you on this thing. So yeah, phalanges, look at them. It's not that hard. Proximal would be closer to the body, distal would be further away, and then the middle. I don't remember them being on the exam, but it's pretty simple. I do remember my exam having at least one metacarpal, if not two. And then I think I was tested on every single one of the some levers try positions they can't handle. I do highly recommend you take a look at their second name. I don't think it'll be on there, but just take a look at it. No, it's not the hand. Let me look at the foot. Wait, let me look at the foot. I think the foot on the exam has the second name. I don't know if anybody, I don't know how, I hope you guys are all following me. I think that the foot on the exam, I'm trying to find my list. The foot on the exam has the both names. So if you don't know both names for the foot, you might get the question wrong. Remember, it's multiple choice. So if only one name is on there, you need to know just one name. Does that make sense why the multiple choice is harder? It's like it would be easier for the bones just to have it be fill in, because then if you only remembered one name, you could still get the point. The problem with, oh, these look like these notes have more. I would look at these look like they have some notes from in class and they're red. These look like they're a little better. I should just delete the other ones. This is wrong. You don't omit these. We're going to test you on these. That's why it says yes, I think. I'm not really sure what that person is doing. Oh, never mind. These aren't better because we're testing you on these ones that they crossed out. I'm just trying to get to the foot right now. Okay. So the foot, the thing that we will test you on, not these arches, that won't be on the test. The tarsals should be the main thing you're tested on. These cuneiform, medial, intermediate, and lateral, navicular or scaphoid. Know that that has two names, and talus or astragalus, cuboid, and calcaneus. You want to know these guys for sure, and both names. And again, the lab exam practice should be helpful for that. So those will be questions 101 through 105. Again, it'll show you kind of how those look colored in, and then how we're going to expect you guys to test on those.
I have a quick question. I don't know if you said this already, but so if it has two names, like if something on the foot or the hand has two names and only one name is on the answer and we choose that one name, would we get it wrong because it has another name?
No, I'm saying, like, let's say it was called, you know, navicular and scaphoid, and all that you see on the multiple choice is scaphoid, you have to choose scaphoid. But if you at home never studied the fact that it was called scaphoid and you only knew it was called navicular, you're going to get the question wrong because you were looking for navicular, but it had a second name.
Okay.
Make sense?
So we need to know both because one of them could be on the exam, is what you're saying.
Yes.
Okay.
Yes. That's really, I wish that I could tell you guys with 100% confidence, like which bones you guys need to know both names on. I know for sure the foot more than the hand, meaning like if you only have time to look at one, look at the foot having both names versus looking at the hand having both names. But I don't want to like 100% say that because it's very possible that the hand both names could be on there too. So I would look at both, but I know that I remember the foot both names. Is that making sense to everybody? I don't know exactly how to tell you which ones. I just know that both names could be on the test. You do need to look at both names. Kind of for every bone, if it has two names, you do need to kind of look at that and know that. I wish that I had a shortcut, but I don't. I'm sorry. It's just, I don't know. It's just the way it is. And then with a multiple choice exam, there are some that can really confuse you. So be really, I just want to try to be really careful on the lab exam. Okay. A lot of like people that I knew, including myself, missed some questions on it because we didn't read as carefully as we should have. Mostly because like on the stress of the exam, everything starts to look the same. But I'll give you this example. So right here, do you guys see conoid or coracoid tubercle? So let's say you're on the exam. So it's option A. Sorry. Conoid, tubercle, coracoid. Need a different color. Let's do red. Conoid, tubercle, coracoid, tuberosity, and coronoid, tubercle, and then I don't know, conoid, tuberosity. Do you see, are you guys starting to see how something can start to look like everything else? You really need to pay attention to the details. The number one tip I would tell you is bring a blank sheet of paper and see if Knudsen will let you use that, or Bender. If he doesn't, on my exam, I used the back of my Scantron, and we did the fill in the blank on the back, but I like made a line down the center and I did my notes on the side. I would try to do the blank piece of paper because it'll make it easier for you. My number one piece of advice for success is write down what you know it is and then look at the options. Because what's going to happen to you when you're on the exam and you don't remember perfectly is you're going to say, wait, was that a tubercle or was that a tuberosity? And you're like, I think it was a tubercle. But suddenly when you're looking at all the choices, you don't remember. Does that make sense? So write it down, because then your first instinct of what you remembered, you just find that. You don't have to get thrown off by like the choices. The one thing I would say that students get really really struggle with on this exam is the choices, because they're so similar and they didn't realize like how similar things are until you get to the exam and you're like, oh no, like everything is looking the same. So just, I would really recommend trying to write it down. If you are too annoyed to write it down, say it to yourself, but just don't get confused when you look on there and everything's like looking the same. Right here, does everybody see 10, number 10, coronoid fossa? So we just looked at coracoid tubercle, also called conoid tubercle, but on the humerus, it's the coronoid fossa. So the way I remembered this for myself on the test, coracoid, C for clavicle, coracoid tubercle, coronoid is on the humerus. Maybe you could think like humor is annoying, right? Like coronoid. I don't think humor is annoying. I'm saying to remember it. So noid and annoying, right? Humerus. But the main thing, C for clavicle. So coracoid or conoid tubercle is on the clavicle. Coronoid fossa is on the humerus. So that's one of the really, really confusing ones, but you can easily get confused on other stuff. So again, my biggest advice would be write down the name.
Question.
Yeah.
For the clavicle, which one would be the right answer then? If they're both on there.
Our correct answer here is my number A, because I only wrote tubercle on one of them. Coracoid, I wrote tuberosity, which would be wrong.
Oh, okay. I see. Thank you.
Yeah. And then do you see how if I had put conoid tuberosity, you would be choosing E? Does that make sense? And how easy it could be on the test to see coronoid tubercle and all of the rest of them, like let's say I had put tuberosity here. Now you see tubercle and you don't read carefully and see that it says, let's just say I put osity, right? And you didn't look carefully and see that it says coronoid and you choose C, that would be wrong, right? You were supposed to choose E because none of the options are correct, because it's actually a conoid or coracoid tubercle, not a tuberosity.
Okay, so, yeah, I misread that.
Pay attention. No, I wasn't, I was just off on a tangent trying to make sure you guys get how it can be confusing on there. It wasn't specifically to you. And I know you guys are smart. I don't mean it like, I'm not trying to patronize you. I'm just trying to, I don't know. I'm just trying to make sure you understand how the test is going to be. It's in my opinion, it was the hardest exam, was the bone exam. I think the muscles are much simpler. The muscles are going to be better for the majority of you, I would say. So I'll just encourage you that once you get this guy over with, the next lab exam for me was not as hard. Okay, so this one is much more challenging. All right, so hopefully that gives you good direction on the bones. This is posted for you in the announcements section. These are the pages you use to study. Don't forget your cardiovascular lab packet. Which lecture exam was the hardest for me? The hardest material was on the final. The hardest material for you guys to study will be the final. It's going to be like brain, spinal cord, muscle contraction. I thought it was very interesting. So in a sense, it wasn't the hardest because it was so interesting. I will say, I think the hardest, yeah, that was the hardest to study for. The difficulty of the final was not as difficult as the other exams though. So once I actually got to the final, the questions were not as hard as the other exams, if that makes sense. So in that way, it ended up not being as hard, but it was hard to study for because you really don't know what's going to be on there. So you kind of have to study everything. But in other ways, the first exam was the hardest for me because I didn't know what to expect. So if you have good study habits at this point, just keep going. If you feel frustrated with the exam score you got on this lecture exam that was yesterday, if you feel frustrated with your exam score, what I would recommend doing is do your best to go back to some type of a basic. I'll just do like a quick 1 minute tangent just in case there's anybody in here that is unhappy with their exam scores. Again, if you're somebody in here who's doing well, just keep it up. But if you don't feel like it went for you like you wanted, I would just go back to the basics and start just really quickly going through your checklist of kind of what I recommend doing. So I recommend watching the lecture at least one time, if not 2 times. The first time that you watch it, you're going to be pausing the lecture probably 1,000 times, and you want to write down everything the professor is saying. So if, you know, he's talking about whatever, you want to write everything down. You don't want to just write it down though. You want to write it down and make it mean something to you. So if that means printing out the PowerPoint slides and cutting out the pictures and like gluing them in your notes, that's what I used to do. If that feels too time consuming and like it's not super helpful for you, maybe you don't do that, but maybe you use a lot of different colors and a lot of different shapes, and you try to make things stand out. You know, if you're talking about the heart, at the top of the page, you write heart chambers in big letters, and then you kind of go underneath there. The more organized you can make it, the better it's going to go for you when reviewing your notes. Maybe you're somebody that flashcards work great for you. You could try to use flashcards. You know, I've known people who studied anatomy with flashcards. I personally don't recommend it. I don't think it's a great idea, but maybe that's something that's the way your brain works and that's the best thing for you. What I would really recommend is, number 1, pay attention to detail. Whatever way you use to study needs to be very detailed for this class. And number 2, repetition. Whatever way you study needs to be organized enough that you can go back and look over your notes, review your notes, repeat your notes. One of the best ways to review and repeat is using concept maps, where you, like at the top of the page, you know, heart chambers, and then you draw each of the heart chambers and then what each of those heart chambers does. Does that make sense? So whatever way you review, find a way you review consistently. If that's meeting up with a friend and talking through the notes, maybe you're an auditory learner and that's re-listening to all the lectures. Whatever way you review, be consistent and review every weekend. So if you go over the heart that weekend, you want to review the heart. If it's re-listening to the lectures while you drive, do that. If it's making concept maps, do that. If it's rereading your notes and that helps you, do that. If it's rewriting, do that. Review every weekend, create your notes for that week. Don't get behind so that before the exam, you're not learning new information. You're repeating the information you've already reviewed every weekend, and you're reviewing again. You're doing practice questions that we've made available, right? You're going over each of your chapters. So number 1, create great notes. Number 2, review your notes consistently and keep up and don't get behind on the content. And then what was number 3? Number 3, give yourself enough time before the exam, not learning anything new, that you can really have time to review and go over everything completely. So hopefully that kind of redirects you if you haven't been doing one of those things. Maybe you've been focusing too much on lab and getting behind on lecture. That's a pretty classic thing that happens. Maybe you weren't reviewing enough. Maybe your notes aren't organized enough. Maybe you're not studying the right way for you. Maybe you learn more auditory. A big problem, I'm almost done, but a big problem that I think happens when this class has kind of transitioned to hybrid is you guys go and you watch that Zoom lecture and a few things can happen. Number 1, maybe you have ADD and you're sitting at home and it's really hard for you to focus. So figure out a way you can break it up that you can focus when you do watch it. That's a big problem. But the other problem is you don't rewatch the lectures. So when we used to go in person, I would wake up at, we would go have lecture at 7 in the morning, and for 2 hours I sat in class and I made notes. I recorded it on my phone and then I would go home and re-listen to the whole thing and then make my notes that day. Does that make sense? So I listened to it twice. I have like an auditory component to my learning. So for me, that was really beneficial, listening to it twice and kind of making notes 2 times over. Does that make sense? So a lot of the problem is you guys are watching that Zoom lecture and the only time you hear that information is just the one time when you're pausing it 100 times. I would recommend, especially if you have any type of auditory component, re-listening to the lecture, maybe while you drive or while you clean your house on the weekend or while you, I don't know, exercise on a treadmill, whatever that may be, it's going to be helpful to you to rehear that information if you have an auditory component. So I think those are the two things, is getting distracted easily at home with the lectures and then not re-listening to them. So hopefully something in there helped you, even if you were happy with your score, hopefully something in there was a good little direction for you to kind of apply for this next exam. All right, any questions for me at all there? Remember that for the exam, if you guys have questions, sorry, you're welcome to put them in the chat. But remember, for the lab exam, the models we use are going to be the same exact ones that you see. We may cover up a number here or there. So like, for example, covering up this number 1, but they're going to be the same models. Okay. We're not going to pull old ones out of the cabinet we've had sitting for 20 years and give those to you. These will be the ones we use. Okay, so on that note, I think I've gone through all of these models at least one time. So what would be a model that you guys would benefit from going over again? So we have the salivary glands. I think I've gone over these guys already, right? So your salivary glands, you just have 3 no functions. This one, you just have the 4 layers. You don't need to know functions on this. Sorry, I'm just going to go through it like this to see if you need to know functions on anything. On this model, no functions. On this model, no functions. On this model, you don't need to know any functions, no functions. So where do you need to know functions? So because I usually get asked this. The white blood cells, you need to know their functions. White blood cell functions. So remember our mnemonic. I feel like I've said this so many times. I'm just going to write it like this. Remember, never let monkeys eat bananas, and the mnemonic is BAM, right? Neutrophils phagocytize bacteria, lymphocytes antigen antibody complex, monocytes become macrophages, eosinophils phagocytize parasites, basophils release histamine and heparin. You guys know that, right? I feel like I've said that so many times, but white blood cell functions you would need to know, including most common to least common, agranular and granular. You guys got that now, right? Granular, agranular, most to least common, as well as their names. So this is the white blood cells. And then for the heart, you need to know the function of the ligamentum arteriosum being in, remember that that's this guy right here. Sorry, give me 1 second. Okay, right here, this one. So remember that that would be ligamentum arteriosum in adults, right? Ductus arteriosus in children. So that would be your functions that you would need to know for the lab exam. Okay, I just saw your guys' chat. Yeah, so let's do digestive and thorax models. Did everybody get that for functions? So these would be the functions you would need on the exam. Good. And then let's go over this model. Okay, so let's kind of try to start at the top. So this part, this part of the model is the same as your larynx, but smaller, right? Here's your larynx. It'd be the larynx, except smaller. So the top here, I'll try to find a good color. If anybody's unhappy with the color, just let me know, we can change it. So this is gonna be your hyoid bone. You should not need to know the greater and lesser horns because that should just be on your larynx model. This is gonna be your thyroid cartilage. This is your cricoid cartilage. These are your tracheal cartilage rings. Let's see if white works better. I don't know. It's kind of a rough area for a color. But those are your tracheal cartilage rings, these little blue ones, right? This is your thyroid gland over here. This like fatty looking thing is the thyroid gland. You can see it's kind of over the thyroid cartilage. And then remember that the edge of the thyroid gland, kind of this point here, that is your laryngeo. It's either spelled laryngeo or it can be spelled laryngeal. Either are correct. So laryngeal prominence or laryngeo prominence, both are right. So that's kind of the upper part of it, the airway. Any questions there? Making sense? Then we'll scroll down. These would be your arytenoids right here. These guys. Arytenoids. Good.
I have a quick question.
Yeah.
So were you on the other one when you put tracheal cartilage rings? Are all the rings combined considered the trachea?
Yes.
Okay.
Yeah.
So just each ring, it's considered like the tracheal cartilage ring, but altogether it's considered the trachea, that portion.
So like the better way to think of the trachea is just to remember it's also called the windpipe. So like your whole pipe is the trachea versus each of the rings would be a tracheal cartilage ring. And then the whole pipe, the pipe or the tube would be the trachea.
So that ends at the cricoid cartilage, right? And it goes all the way down there. Or is the whole thing the trachea?
Whole thing would be the trachea. The trachea, you're not going to be asked this on a test. The trachea should start up here and then go all the way down until it splits into the bronchi. But you won't be asked that. You'll be asked for the tracheal cartilage rings. But
Okay.
just for your knowledge, yeah, the trachea is the trachea until it branches into the bronchi.
Okay, perfect.
So like this part right here would be trachea.
Okay.
And then each of those blue would be one ring. Does that make sense?
Yeah. Okay. Because I was wondering, like, if it's just the entire thing or if it was just like the rings combined.
Like on this one right here, same thing. Each of those would be a tracheal cartilage ring. Then
Right.
the entire tube is the trachea.
Okay.
And then when it splits and it becomes two, that becomes the bronchi. This would be the right bronchi and the left bronchi. And then the same thing over here, right? So the nice thing is the heart and this model, a lot of the stuff is repeated.
Mhm.
So that's why if we go over the thorax, I'm probably not going to do the heart too, but you can see that here, right? We call them the primary bronchi. So the first split is the primary bronchi. That's where 108 is pointing, is to the primary bronchi. So we have, like we said, the trachea, which has the ring. So we're going to write trachea here. And then this is going to be, I'm going to do one. I'll just do 1B. Good. 1BR. That means primary bronchi. Primary bronchi. Good. And then we have our secondary bronchi. So we're going to do 2. I'll just write 2. So this is secondary bronchi. Remember, there are 3 on the right and 2 on the left. So these are secondary bronchi. So on your test, we could point to these guys and you would need to identify them as secondary. And then once the secondary branch again over here, these would be all tertiary. So 3, tertiary means like 3, like tres in Spanish, right? 3, tertiary. And then let's look at it kind of zoomed out more. So if we look at it, there's my big picture here. I want one without the heart in it. Okay, so on this guy right here, we'd have our primary, which is where 108 is, and 109 is pointing to a tertiary. Does that make sense? So once we're done with the secondary here, it becomes tertiary. So those are all bronchi. As long as they have these, whoa, that got really close. As long as they have these rings on them, they're a bronchi, right? Rings, where's my thing? Rings equals bronchi. I know that ring can also equal trachea, but we're now in the area of the bronchi. So rings would equal bronchi here. You can't see bronchioles on this model. You can kind of see these are like alveoli, but we're not going to test you on that. Okay, and then if we look at our circulation, right? Remember that these guys here are getting the oxygen. So our pulmonary, let's get the heart in it, and then that'll be easier to figure out what's going on. Our pulmonary arteries take oxygen away from the heart, right? So we see here that we have our, let's see what color. This is our right ventricle, correct? Remember that that pumps our deoxygenated blood to the lungs through our pulmonary trunk, PT, or our pulmonary artery. Pulmonary trunk is the same thing as the pulmonary artery. So pulmonary trunk equals the pulmonary artery. On your exam, you could see it either way. You could see the pulmonary trunk as a, that's one of the things that you could write in your multiple choice. You could also write pulmonary artery and that would be correct. Either way is fine. Pulmonary arteries would not be correct though, because all of these blue vessels here that you see, those are our pulmonary arteries. And that's different than the pulmonary artery. Does that make sense? So the little guys, are pulmonary arteries. Remember, arteries always go away. So in this case, they are the blue vessels versus our red vessels are pulmonary veins in this model. Remember, they return to the heart. So they're coming back to that left atria. They're bringing that oxygenated blood flowing down into the left ventricle, and then they pump that blood out here into the aorta. So we have our ascending aorta, and then the aortic arch, which branches 3 times, the first into the brachiocephalic trunk. And this is the same thing. You can either say brachiocephalic artery or brachiocephalic trunk. In both cases, if you want to know which one I would recommend writing down, I would recommend writing trunk. Trunk is like more correct, but it's also written down in textbooks and it could be on your test as artery, right? So pulmonary artery, pulmonary trunk, brachial artery, brachiocephalic artery, brachiocephalic trunk. And then we know that the next one is the left common carotid, and then the left subclavian. I always remember it as the S is at the end of the alphabet and the C is closer to the middle. These also go alphabetically, right? B and then C and then S. Does that make sense? And then remember that your brachiocephalic trunk is going to branch. We're going to see that in a second. But I'm going to draw it right here because we're already talking about it. The inside one is the right common carotid. So the common carotids are like next to each other. And the outside one is the right subclavian. So subclavians are on the outside, common carotids are on the inside. Remember, the brachiocephalic branches into the right. Common carotid on the inside, right subclavian on the outside. You're very likely to get tested on that on this model because it shows it branching. You will be tested on this concept on the lab exam in some way, either on this model or on the heart model. You will be tested on right common carotid and right subclavian. So make sure you know that. Okay. Everybody good on this part? I'm gonna erase this. I'm not 100% sure if this model is in the tutoring center. If you guys have any specific questions about using the models in the tutoring center, ask Dan. Dan is the guy who lets us into this meeting in the morning. So before you guys leave today, if you want to ask him about Monday, like using the models, don't leave the meeting, leave the breakout room. And then when you leave the breakout room, you guys can go and just ask Dan really quick, just say, hey, Brooke mentioned you guys have the models, like do you guys still have the bones and which models do you have? I'm 99% sure they have everything, but I haven't been to the tutoring center in a few years now because I do the nursing program in Modesto, so I just do Zoom online. So you might just want to make sure with him, but again, I don't see why there would be any reason that would have changed. But in the past, they had the thorax model and they had all the bones. So I don't see why there's any reason that would be any different now. It should be the same thing now. Okay, so let's take a look at kind of one more look of the blood flow. So remember, we have our superior vena cava bringing blood into that right atria. This is our right atria. Remember, we have our auricle on each of the atria. Right auricle, left auricle. You guys know what those are, right? They're like the little leaflet things. And then you have your inferior vena cava. Down here is our diaphragm. It's kind of that muscle. Remember, that helps with breathing. And then we can see our trunk. Do you guys now see your right common carotid up here? And this is your right subclavian. Sorry, that's really hard to see. Does everybody see what I'm talking about when it branches up here? We're good on that? This here is our, what am I trying to think of? Should be our two different carotids, but I'm going to need to look at that. I want to say that one. Good. Actually, maybe they're brachiocephalic veins. That would make sense. Check our key, see what I missed. If I didn't say anything. So the epiglottis, so when you look right here, actually not really sure where they're saying, oh, it's a side view of it. Let's see if I have one of those. Here we go. The epiglottis is this guy right here. So this structure here is your epiglottis. And then this one right here is your glottis. The white would be your glottis. Good. Epiglottis and glottis on the inside of that larynx. Looks like it specifies the left from the right pulmonary artery. I'm not really sure why it does that. Let's see if I can get a. Pulmonary arteries are going to be these guys. I'm not really sure why it's specifying that here. This would be your left pulmonary artery. Pulmonary artery. I guess they're just saying left because it goes this way. I don't know. That's you don't need to put left on the exam for that. You can just put pulmonary artery. I don't know if everybody saw what I was talking about. This here, left pulmonary artery. I don't know why they're specifying left. You can just put pulmonary artery. You don't need to specify that. Left ventricle, aorta, aortic. Let's look at we'll do the heart really quick. Pulmonary trunk. Do that. Moving. I showed you that. Thyroid, thyroid gland. I want to see if they have. Yeah, they don't do brachiocephalic veins on here. Okay. All right, we're good. I'll just show you guys the heart and then I got everything else already. So when you guys are looking at that heart, remember I already showed you kind of going from the outside the chambers, but let's do our recap on what's happening on the inside of the chambers. So remember, this would be your superior vena cava here, flows into our right atria through our what valve, right? Everybody remember our anatomy. So our tricuspid is also our right AV valve. Flows into our right ventricle, out of our pulmonary semilunar valve, into our pulmonary trunk here, okay? And that flows back into the left atria, which is just visible right here. So we're going to put that. The left atria flows the blood down through, remember this pulmonary trunk goes out to pulmonary arteries, and then it would come back through pulmonary veins. Good, remember those come back to the heart. So I'm going to kind of draw it like this. Okay, and those go right here into the left atria. And then remember we would have our bicuspid or our mitral or our left AV, atrioventricular valve, flowing into our left ventricle, into our aortic semilunar valve and our ascending aorta. Good, and I'll show you on one more picture what that aortic semilunar valve would look like. Any questions there? Good, erase that. Let's take a quick look at our aortic semilunar valve, and I'll show you the esophagus too. This right here, 107, is the esophagus. Diaphragm, esophagus. Good. If you guys don't, if I move on too fast and you don't get something written down, please tell me. I'm not trying to go too fast. This is aortic semilunar valve right here, right? So this is our left atria, our left ventricle, and this is our bicuspid, mitral, left. Good. Any more questions on this model? We feel pretty good on this guy. And then we'll go over digestive. And then I'll let you guys go at that point. And then I'm here until noon. Well, actually, if any of you guys need to go now, that's fine. I've already gone over digestive and SI. I'm here until noon though. I probably will be ending a little bit before 11. If you guys have questions or need help with studying, please stay and I can help you guys. I've already done digestive model. I know I did it really quickly and I'll go through it more slowly now. But if you did need to go, you're welcome to, you guys can head out now if you've already gone over this and you don't need help with it. So these are your lips here. These are going to be your incisors, the teeth, incisors, tongue. This is your hard palate. So you have a hard palate at the front here, and then your soft palate here. I'm going to divide that because you have your hard palate, your soft palate, and your uvula. So we're going to go here. The front part is the hard palate. This part here is going to be your soft palate. And then the back here, your uvula. Up here, your nasopharynx. Okay. Then you have your different types of tonsils. I'm going to switch to a different color. Let's do green for tonsils. This guy, it's kind of weird looking, but that's your adenoid pharyngeal tonsil. Then we have our palatine tonsil right here. And then our lingual tonsil. So you have 3 types of tonsils you need to know for the exam, right? Adenoid or pharyngeal. Lingual tonsil is easy to remember because that's the one that is on your tongue, lingual. Palatine, you can think of it in line with your soft palate, palatine, and then adenoid is above. Maybe think A above, adenoid, pharyngeal above. So that's your nasopharynx. This section here, I'm already in green, so hopefully everybody can see. This section here would be your oropharynx. So kind of at the back of your throat is your oropharynx. I'm going to write that, back of throat. All right. As we go down, let's do a different color. As we go down, we would call this your laryngopharynx, right? The area where your kind of larynx is. Laryngopharynx. That should be everything. I think potentially you have nostrils on there. Hopefully at this point you guys know what nostrils are, but nostrils would be your nose entry. Everybody got everything there? Keep going down. That's good with you guys. I'm going to erase this. All right, let's look at our next view. So as we swallow, the food will go down the esophagus and into the stomach. Good. I'm not going to label esophagus. I feel like that's pretty, that one's kind of like a waste of energy to label that. So this is our esophagus into our stomach. So this is, I'm going to zoom on this and we'll kind of label this guy. So we've got, now I can label esophagus. Then we remember that this sphincter, right, has 2 names. It's called our upper esophageal sphincter, but it's also called our cardiac sphincter. Why? Because the very first section of the stomach here is called the cardia, right? The cardia is that very first part. Remember, this is all the anatomy stuff, so you do need to know this for the exam. This part here would be your fundus. The main portion of the stomach is the body, right? Body of the stomach. And then this area here would be your pylorus. And then we know that the pylorus leading out would be your pyloric sphincter. Lining the surface of the stomach is going to be your folds. I'm going to put that in parentheses because that's not how it'll be on the test. We want you to know that those are called rugae. Okay, so the folds are called rugae. This is your liver. Your liver has 2 different ligaments. It has number 44, which is your round ligament. And you guys can see that really easily because it looks round like a little dot. And then it has your falciform ligament, which is these 2 lines right here. I'm going to kind of write them like this, and then I'll try to draw a little arrow. Okay. Right here, 47. This is your gallbladder. We're going to write GB because I think we all kind of get the idea of what a gallbladder is. The red vessel is your hepatic artery. Hepatic artery. Arteries. The purple vessel right here, 52. That is your hepatic portal duct. Portal duct. Okay, so that's that purple vessel. And then you can see that there's 3 different vessels. So we're a little far away, but I think this is nice because then I can get more stuff on the same picture. So it's very faint. But this number 50, I was trying to change my color. Okay, let's just leave it in pink. This duct here, that portion is our common bile duct. So remember, I changed my font. Remember, the common bile duct is the one that attaches itself into the duodenum. So you can kind of see it here. That would continue right here. And that are both the common bile duct.
It's okay, it's okay, it's okay. It's okay, it's okay.
Did someone have a question? Okay, so common bile duct is this guy right here. And then we see our cystic duct. Let's change this to green here. Cystic duct is the one that would connect from the gallbladder to the common bile duct. Let me change my color. Cystic duct. And then our hepatic duct is going to be on the other side. Let's do blue. Right here. So this one here is the hepatic duct. And yes, for the exam, you do need to know those. Okay, so you need to know hepatic duct, hepatic portal duct. I'll do it in yellow. Hepatic portal duct again is this one here versus the hepatic duct. So hepatic portal duct is this one in yellow. Hepatic duct is this one up here. Cystic duct connects the gallbladder to the common bile duct. And then the common bile duct is this one down here and this one. You have your pancreatic ducts, which are the white ducts. And it's sitting on top of the pancreas, which is kind of this like weird looking yellowish structure here. The first section of the intestine is your duodenum. Here, it's very small. It's this, that doesn't look clear. Oops. What did I erase? I erased the cystic duct. No, common bile duct. Okay, so let me try in a different color. I'm gonna try it in white. Okay, so this here, this section. I'm trying to just make sure it's like extra clear. That's the duodenum. Not where I'm writing the letters, right? Because that's something else, but the duodenum is right there. Okay, so that would probably be a good picture to take. That's kind of everything in liver, stomach, and pancreas. Any questions at all?
Quick question. I'm sorry, you might have answered it. I was kind of going back and forth and writing stuff down, so I wasn't 100% listening. We didn't need to know the function of this diagram, correct?
No, no functions for this one. The functions are white blood cells and then the ligamentum arteriosum, ductus arteriosus.
Okay, thank you.
Yes, it is supposed to be lower esophageal sphincter. Thank you. Whoever saw that. Lower esophageal sphincter. Good. Upper would be at the top. Sorry about that. That's a typo. Lower. Should be lower esophageal sphincter. Good. Everyone got everything there? Okay, I'm gonna go ahead and erase this. All right, let's take a look at the lower part of the digestion. So when we leave our stomach and duodenum area, we're gonna kind of get into the rest of the small intestine. I'm gonna try to, whoa, sorry, that's very close. So you can see it again, pancreas, duodenum up here. Trying to just get it just. It's always very hard to zoom these. Okay, that's pretty good where we can see everything in one shot. So like I said, I'm gonna write a D up here, duodenum. We already labeled everything up there. The next part of the intestine is the jejunum. Then the last part, our main portion, would be our ileum. Okay, so if it's labeled down here, we're looking for ileum. If it's labeled at the top, we're looking for jejunum. The ileocecal valve is going to be where the ileum connects to the cecum. This part right here. Okay, I'm just going to kind of highlight it. Ileocecal valve. Again, that's where the ileum connects to the cecum. That's the end of the small intestine and the beginning of the large intestine. So let's do the cecum in a different color. Here would be your cecum or your blind pouch. For the exam, it is possible that we would ask you on a multiple choice. Not a multiple choice. These are going to be fill-in. And we might say, write both names. So if you just write cecum, you would get half a point. And if you write blind pouch, you would get the full point. Does that make sense? So if the prompt says write both names, you would need to write both names. So coming off or dangling off of the cecum right here, you can barely see that, let's see, is your appendix. The next thing that we get into is your ascending colon. Remember, your colon is your large intestine, so the part that goes up is your ascending colon. It's removed right now because that way you could see what was underneath, but the transverse colon goes right here. I'll show you when we get over there, but it's just a missing piece on this part. Transverse colon. Then you're going to have your descending colon. Descending. And then your sigmoid. This is our descending here. And then our sigmoid colon is the last part here. And then we have our rectum here. And then our anus. I'm just going to write anus here. Okay. And then you kind of can see a few things on the surface of it, but it's going to go better if I show you on a different picture. Okay, so that would be everything for large intestine. and we're almost done with the model. Okay, so let me just show you the few more things on a different picture. I'm gonna erase this. If you wanted to take a picture at all, do that now. Okay, I'm gonna erase it. All right, and then let's take a quick look at the few more terms and then we'll call it there. So if we look, let's see, what am I looking for? This picture is nice to show the ileocecal valve really well. And it shows what I'm trying to show you too, which is perfect. Okay, so this again would be, let's do that in white, your cecum or your blind pouch. And then this guy right here, that is your ileocecal valve. It's also called the ileocecal junction. Okay, so what I want to show you is Haustra, Taenia coli is the name for this white band, right where I wrote the letters Taenia coli. And then each of these segments is called a Haustra. Okay, and those you need to know for the exam. So Haustra and Taenia coli. All right, I'm gonna erase this and then we're gonna go look at our list and make sure I didn't miss anything. So the nasopharynx are also called the sinuses. I only wrote nasopharynx, but basically where the nasopharynx was, you would also say sinuses. All right, so that is everything for the digestive model. The only thing I didn't show you is the transverse colon, which again, I already kind of referenced, but transverse colon is just the part that goes across. It had been taken out on the part I showed you, so it would be this guy right here, transverse. Okay, and I'm gonna just end the session there. If you guys have questions at all, please hang out, please stay and ask. And if not, I will see you guys on Monday, 4:45 to 6:45 p.m. Thank you guys. On Monday, I think that I'm just gonna make Monday a like open question area. So if anybody needs last minute help on anything, I will be available on Monday, just because I think that everybody's going to be taking the exam Tuesday. So I'll make it like for questions. If you guys have any last minute questions, I'll be available Monday night and you guys can just stop in. I can go over any models that maybe you need help with, or if you had questions on the bones, I can help with those.